Welcome back, everyone. Joining us now to talk about the way COVID-19 is spreading in such a rapid-fire way is Dr. Ellen Foxman. Dr. Foxman is an assistant professor of laboratory medicine and immunobiology at the Yale School of Medicine. We so appreciate you being with us.
Happy to be here.
So we want to get some perspective on the spread of the disease. We've talked about, like I said before the break, we want to be more like South Korea, less like Italy. Why is that?
Well, the key thing about this virus that makes it different from the normal common colds and flus that we get every year is the fact that the human population has never seen this before, which means we don't have any pre-existing defenses against the virus. And that makes it able to spread from person to person really fast. And for that reason, we really need to try to slow it down. And the example you gave is a good example of that. If the virus spreads from person to person too fast, you get sort of what you saw in Italy, where everyone's getting sick and coming to the hospital all at once. If people gradually get sick over the course of time, the healthcare system can absorb that and take care of everyone and provide them the best medical care. But if that happens all at once, the healthcare system can be overwhelmed. So the point of doing what we're doing now, which is social distancing and trying to minimize extra contact with people, is it's a very simple way. It's hard to do, but it's a simple and effective way to slow the virus down. And that's what we're trying to accomplish, just so we can let our healthcare system catch up and expand and have time to be able to give everyone the best care and the best outcomes possible.
I think we've all been talking about social distancing and flattening the curve, and there's been a lot of outrage at some of the videos we've seen in Florida of spring break beachgoers not heeding these warnings and not isolating. And I think it's very upsetting to some people. How important for people to social distance at this time?
It is quite important, because if you think about it, imagine, occasionally there's a car accident, for example. But imagine if every car accident of the year happened on the same day and all those people came to the hospital at once. It would be very hard to cope with. Whereas if one thing happens one day, one happens the next day, it's very easy to give the people who come the best care. And that's what we're trying to do, is prevent a bunch of people getting sick all at once.
Well,
Now,
that's a great analogy. It really is.
Yeah. So the viruses that we get every year, a lot of people already have some pre-existing defenses, because when your body has seen a germ like a virus before, you build up defenses so the next time you're less susceptible. And that makes it slower for the virus to spread around. We don't have that for this virus. If we had a vaccine, that would be another way to do it. That would be fantastic, but it takes a while to develop a vaccine. So the other choice we have is what we're doing now, which is the social distancing and just trying to slow down the spread of the virus by staying away from each other, basically.
What do you think is the reason that some people who contract this virus seem to have little to no symptoms, and others obviously have a bad situation, sometimes even fatal outcome?
Now, that's a fascinating question, and that's a very important question. We don't know the why of it. We know a little bit of details. For example, young people, especially under the age of 20, even though they have the virus, even though they have changes on their X-ray, they still don't seem to get very sick. And that could be because of their lung biology is different at those ages. It could be their immune system's different, or other things we don't know yet. Some people, especially in the very older age categories, can get very sick. But, an important point is a lot of people think, if I get this virus, I'm going to get very sick and be in the ICU. Even in China, where it was quite fast spreading and quite bad, a big study estimated that about 80% of people had mild to asymptomatic illness. And that could even be an underestimate, because when there's a new disease, the people who come to get tested are the people who are the sickest. People who are asymptomatic might not even come to get tested. So that's the kind of thing that we're going to learn in the coming weeks as we get better and better tests, and will help us predict when this epidemic might end.
Yeah, I think that's a big thing on everyone's mind. I want to get to some of the viewer questions here. This is from Lee. He wants to know, what does being quarantined for 14 days do? If someone has tested positive for coronavirus and are quarantined for 14 days, are they cured on day 15? Meaning, are they able to be amongst others without spreading the virus?
Oh, that's a good question. Actually, I think that usually the idea around quarantine is you don't know if the person has the virus. So if someone's exposed, but you don't know if they have the virus, if you don't have a good test to say exactly whether they have the virus or not, the viral symptoms usually appear in like 5 to 7 days. So if they wait for 14 days and they still don't have symptoms, it's probably safe for them to go around. Now that we have better testing coming online, it might be possible to actually use tests to shorten that quarantine period. As far as someone who's sick with the virus, that's a different story. Then we're really talking about not exposing people to someone who's sick. And then again, that's more a matter of when does that person stop shedding virus, which could be after they recover. There was a recent study showing that some people can shed virus even after they recover. So that's a different situation. Usually we think of quarantine as somebody who might have been exposed and we're waiting to see if they have the disease or not.
That makes a lot of sense. This next question from Ernie: in light of social distancing, which we have said a safe bet is about 6 feet, how safe is that? And he wanted to know your thoughts on whether or not that particular distance is okay.
Yeah, I mean, that is the distance that's quoted because it's thought that this virus spreads in respiratory droplets, which is like if you cough or sneeze and like a little fluid flies out. That is kind of heavy and it falls to the ground with gravity, and so it can't really fly further than 6 feet. You know, that's the sort of the ballpark how far that distance can go. So that's sort of consistent with you're not going to get something in a respiratory droplet if you're 10 feet away from somebody. That's not really what's going to happen. So I guess that's where the 6 feet number comes from. But I guess another thing we need to think about is also touching surfaces, as another speaker earlier in the show was mentioning. The virus can stay on surfaces for a short period of time. So another reason for social distancing is if you're only sharing your house with your family, you're only exposing to them. But if you're going to work and touching doorknobs and phones and things, then you're sharing it with everyone with that shared workspace.
That makes a lot of sense. Some good advice. I know we don't know when this will finally be over. Is there some risk for it coming back again too?
Well, you know, certainly like all the flus and the common cold viruses we get every year, they come back in a seasonal way every year, but it will never be like this again, probably, because next time we're all going to have had a previous exposure. So
that is some good news.
So even the swine flu, you remember in 2009 there was the swine flu epidemic. What people might not know is that same flu virus comes back every year now, but it's just another one of the seasonal flus, and it's in our flu shot now. So it's not, even though that first year when it emerged, it was of a lot of concern, but now it's sort of one of those regular flu viruses that it's in our vaccine. We all have some pre-existing defenses against it, so it's not as big a deal.
All right, well, you're leaving us on a high note. Dr. Foxman, thank you so much for being with us and for your great insight. We certainly appreciate it.
Thank you. Glad to be here.